80% of us have some degree of gum disease. And since gum disease is not painful in the early stages, we might miss the warning signs. Let's understand more about oral health and dental hygiene. Joining us in today's Apollo 24/7's Health Hour is Apollo's expert periodontist and implantologist Dr. Adosh Lall. Join us in this live session today at 11 a.m. and ask all the questions regarding your dental health. See you there, 11 a.m. sharp.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaste, namaskar, and welcome to Apollo 24/7's Health Hour, a show which brings you an expert from Apollo every week, and where in the live session you can ask your questions and we get an answer from the expert. Today's show, we are going to talk about dental problems, causes and prevention. We are going to be joined by an Apollo's expert periodontist and implantologist, Dr. Adosh Lall, who is going to join us very shortly. You get ready with your questions, and a lot of you have already registered with your questions. We're going to ask these questions. Let me remind you that the questions that you type on the YouTube chat, make sure that you put in your age, gender and all the queries into one question so that it's easy for me to ask your query and get the right answer for you. And also on the show today, you will find a health quiz where I'm going to ask you 3 questions. That's towards the end of the show, where Apollo 24/7 will be giving you gift vouchers. So let's see who the winners for today are towards the end. And also we're going to give you lovely discount offers and coupons. Stay with us and let's start the show for today by this wonderful initiative के बारे में बात करेंगे और show को start करेंगे. This is a great initiative which is called Sachi. Sachi is Saving a Child's Health Initiative, which is free pediatric consults for every child in need. So Apollo 24/7 in association with Apollo Foundation is on a mission to make quality healthcare accessible to underprivileged children at no cost. This is to benefit children across India. More than 10 plus pediatric specialties who are renowned Apollo pediatricians are going to be a part of this. Please scan the QR code to know more about this wonderful initiative and spread the good word. Let's start. Today is our day where we talk about dental problems, the causes and prevention. I'm going to invite today's expert, Dr. Adosh Lall, who's a senior consultant periodontist and implantologist from Apollo Hospitals, Indraprastha, New Delhi. And get ready with your questions as doctor is going to join us today. He is a is more than 27 years of experience in dental practice. He's the member of International Academy of Periodontology and other esteemed organizations. He's a fellow at Pierre Fauchard Academy, diplomate in International Congress of Oral Implantology, engaged in graduate and postgraduate dental education since the last 14 years, and he's a distinguished clinical tutor at Apollo Hospitals Educational and Research Foundation. It's an honor to have you on the show, Dr. Adosh Lall. Namaste and welcome to the show.
Namaste.
Good morning. So, as today is being celebrated as the Oral Health Day, let me understand where India is at oral health. Where would you rate our country at oral health, Dr. Adosh?
We should be one of the finest at treating dental problems. Definitely.
Oh, wonderful. That's very positive there. So, does it also mean that we have a lot of problems?
Oh yes, we are a big population, so we have lots of problems as well.
Okay, so when I talk about dental issues, dental is not just cosmetic, it's not just the color, it's not just the order of the teeth. Of course, that is a major concern for a lot of people, but it is also deep within. When I talk about dental issues, it's not just dental. Is it also related to gum and how important is our gum health?
Teeth and gums go together. A tooth is surrounded by bone, and the bone has gum over it. So you can in the mouth, or when it comes to the teeth, you can either have a problem in the tooth or you can have a problem in the gum. So they go hand in hand, and there's something called the pig to the white ratio. If they don't match, you won't look good.
Okay, oh, that's also there. So, but gradually gums do recede. That's what I've seen. As a child, I used to have nice thick gum line, but as I crossed 40, 45, reaching 45, my gum line is receding. Is that normal?
No, that's not. See, if the tooth starts looking big or long, that means you're losing gum or the bone underneath it. And that means that some kind of gum disease is starting, and it's time that we start taking care of those problems, because otherwise, eventually the tooth will become loose and you won't be able to enjoy eating them.
Thank you so much for that advice and caution. So let me understand more of gum disease then. As I am told that gum disease is very silent and it does not give you any kind of signals or warning signs before. Is that true? And what is the sign of gum disease? What are the types of gum diseases?
Yeah, so Jhansi, gum disease is a very silent disease, and the only manifestation of the way it exhibits itself is bleeding in the gums. Then you can have itching in the gums and foul smell, and these are about the symptoms. If you don't take care of your gums at this stage, which is normally appears to be harmless but it isn't, uh, the later stages make the teeth become loose, and then the efficiency to chew reduces, and the entire charm of your teeth, or the reason for what the teeth are available are for, are lost.
Right. So what happens if I ignore the gum disease, which is starting onset, if I don't catch it young or early?
Yes. Initially, if you feel that your gums are bleeding and your mouth is smelling and you feel that there is itchiness in the gums, then the first thing you need to do is you go to a gum specialist or a periodontist, and they ensure that the gum disease is reduced or is totally removed from the basic levels, and it does not progress to the next problem called periodontitis, which is basically loss of bone. The minute you start losing bone, as I said, that would be losing the tooth's efficiency. It'll be a loose tooth. We don't want that happening. So that's how it's important that in initial stages you must treat that.
Okay. So there is treatment. There is kind of, you can help if there is a gum disease which is in the earlier stages. Otherwise, it'll, as you have mentioned, that I might lose the tooth later. What happens if I
Right.
don't address a shaky tooth, or if I've lost a tooth and if I don't choose to replace the tooth, what happens?
If you don't replace your tooth, then there's a cycle, vicious cycle which starts happening. What happens is that imagine there's one tooth missing in the lower jaw. The upper tooth would start sliding into that place. It will start coming down. The back
Okay.
tooth would start coming forward. It's basically called migration, and the tooth ahead of the tooth which you lost will start going backwards. So the entire bite system, or the way we chew, or the occlusion is what we call it medically. In what we call it is that the bite collapses if you don't treat it for a long time. So bite collapse can cause a whole lot of problems. It can give you inefficiency to eat, neck problems, problems in the joint, problems in the back. It can lead to all that.
Okay. So, how often should one go and meet a dentist? And what is a normal routine? And then, if somebody has a problem, what should be their visit tenure?
I normally tell my patients that you should get yourself checked every 6 months, and you
Okay.
should get a cleanup, or a scaling, or a routine prophylaxis every once a year at least.
Done. So, it should be like a mandatory लिख लो कि ये 6 महीने हो गए, मुझे जाना है और एक बार प्रॉब्लम है या नहीं है, फिर भी मुझे जाके दिखाना है.
Checkup, and every 6 months checkup, and a cleanup with X-rays every year.
Right. So there is yet another thing that जब पेन आता है तभी मैं डेंटिस्ट के पास जाऊंगा. जब तक पेन नहीं है, जब तक वो चल रहा है, चला लूंगा. What kind of damage will this attitude do, doctor?
So everybody that I come across is scared of the word RCT. You want to avoid an RCT, the best way to do it is that you get your tooth filled if there is food getting stuck at any point of time in your mouth. If you feel food is getting stuck and you don't fill that up, that will progress to your nerves and it will start hurting you. So the first and the most important advice is, if food is getting stuck, please get it checked.
Done. So the food getting stuck and also bad breath. There is a whole lot of issue, and bad breath is a big common concern in a lot of people. What is the cause of bad breath? Is it dental hygiene or oral hygiene?
So, foul smell has various causes. It can be because of the mouth, and it could be related to your teeth. It could be because of acidity. It could be because of a chest infection. So, if the first thing that the dentist would do is that ensure that the reasons for the mouth are eliminated. Now, the reasons for the mouth, the first one is a dry tongue. When we get up in the morning, the tooth is, you get a foul smell. The minute you clean your tongue and your palate and your teeth,
Okay.
the smell goes away. In case it doesn't, that means that you've got tartar deposits which need to be cleaned, and that's the professional cleaning which we say once a year has to be done. Uh, the third reason that could be is food getting stuck in between your teeth. That is called the interdental spaces. If the food gets stuck in the interdental spaces, it putrefies and gives you a foul smell. So mouth can have three reasons. You should eliminate that. If it's still not going, then you should maybe go to your physician and get that checked.
Done. So, is there a link between general health and oral health? Do each other cause an impact on the other health?
Oh yes. So gum disease, as I said, or the next stage periodontal disease, that has directly been proven that it can eventually cause a whole lot of problems to your body. And now all the more, research has proven that if you have gum disease or periodontal disease, it could, if it's a pregnant lady, it could have adverse effects on the child. You could have, it could cause direct relationship with diabetes or your blood sugar management. People who have bad oral health might not be able to maintain their blood sugar very well. So it's directly related. It's been proven. And diabetes can cause problems in the mouth, vice versa as well. uh, Jhansi, the bloodstream from in our body is the same, whether it's the mouth or whether it's the heart, it's the same. So
Right.
this bleeding can affect your heart as well. Lastly, these problems can also lead to respiratory infections like pneumonia or other further complications to that.
Sounds quite
So I feel
complicated.
that
So,
so oral health has a direct impact on your systemic health, and I feel that it should be maintained.
exactly, and this is one great call, that you do not ignore certain issues and take it to the next level so that they cause other issues in the system. So thank you so much. And with that, I would want you to elaborate on how to prevent these tooth decay, gingivitis, or any other gum diseases.
So this would basically mean, how do we improve our oral hygiene? If you improve your oral
Yes.
hygiene, you don't get those diseases. And you start with something called interdental cleansing. The spaces between your teeth is where, as we age, especially, food accumulates, and that those areas need to be cleaned. Followed by your routine brushing, and you should avoid in between meals, because snack in between meals is a big no-no. So normally what I tell my patients is that you brush twice, after dinner and after breakfast. You In case the third meal you don't need to brush, but you can definitely do something called very nice rinsing. And there's a concept called tongue brushing, wherein you had your meal, you rinsed your teeth. While you're doing your other things, you can just roll your tongue and feel if there's any food getting stuck. So tongue is very sensitive, very smart organ. It tells you if there is any food accumulated in those interdental spaces. And that particular area you can possibly use a interdental brush or a dental floss, depending on the type of contact that you have, and clean those areas. And that would ensure that you don't develop gum disease at all.
Fantastic. And there must be a lot of progress in advancement in treatment options which are available right now, because if I used to remember the earlier days, it used to be really cumbersome, painful processes. So has I suppose dentistry has reached to an advanced stage. What are the latest developments now?
So, dentistry has become digital to a very large extent now over the period of years.
Right.
The first thing that happened many decades ago was X-rays got digital. After the X-rays got digital, the next thing that happened was treatment planning started getting digital, because you use those X-rays or those scans to plan your treatment. Then came in treatment as actual treatment, wherein you had to make impressions for giving people artificial teeth. That got digital. And next was teeth manufacturing got digital. And that, you took an impression, or you make an impression and you send it to the lab makes it digitally, sends it back to you. And the last thing that is now coming, is more or less here, is the dental robotics. So everything about dental is getting digital and finer, I would say, more technique sensitive, and specific to the patient.
Right. So, in order to access all of these, you need to visit a dentist first for a regular checkup. That's when you will know if you require anything, and there is good help available. And do not ignore dental health. This is the call for today. Dr. Adosh, with this, let me start taking the questions from our audience. The question that I wanted to ask is already asked here. So let me combine these two questions. Mr. Ravi is asking, his child is 5 year old, and how to get rid of cavities in children around 5 years old. And also very importantly, these milk teeth, I see that this generation children have a lot of dental issues even before they get their permanent teeth. What is your advice on this?
So the first thing he should do is that remember that milk teeth are a little more susceptible to caries, and they are not as strong as your permanent teeth, so they get affected faster. And first and foremost is that if you feel that there's a spot in your child's tooth, it has to be filled. If there's a black spot, it has to be first checked, then it has to be cleaned and filled. Because if you don't, then he'll eventually that spot can develop into a big cavity reaching the nerve structure, and it'll start hurting him. And the last step sequence would be that he might develop an abscess. So if it is not paining, then it is still time that it could be filled. If it has started hurting the child, and if he complains of pain, then you would have to maybe do something called a pulpectomy, which is a child version, or the the pediatric version of a root canal, which we normally all of us dread. So that's how it should be treated. So it has to be checked, filled, and cleaned.
So it has to be a continuous process, as you were mentioning earlier. The mid-meal snacking happens a lot with children, of course adults as well. I'm not saying that we are very good with it, but children, yes, they have a lot of sweet and a lot of candies, and the brushing oral
Not
hygiene
just
gets really.
they, children have a lot of milk, so you need to make sure that the child, especially after having the last milk milk feed in the
Whatever.
night, if possible, make sure that they have a little water to kind of clean their teeth so that the teeth they're not affected adversely.
So regular rinse will help, doctor. Do we need to add some additives, regular oral rinsing?
I normally don't like to advise too many adjuncts unless it's serious grave periodontal or gum disease. Till then, just clean water. That's about it.
That's nice. So
That
gold.
helps to rinse it. Yeah, yeah,
Yes.
yeah.
Done. The next question is Deepak Shakti's question. My teeth are very sensitive. I cannot eat anything hot or cold. What is your suggestion to him?
So Deepak, the first thing you need to do is find out what that sensitivity is due to. I mean, we could write down a toothpaste or a medicated paste and you could start off, but it's like saying that you have a headache and you for every day, for every time that you get a headache, that is every day, maybe 5 times a day, you take a tablet. So that doesn't happen. So the first thing you do is you identify the reason of the sensitivity, whether it's because the tooth has got worn out, or because there's a cavity, or there is gum receding. So
Okay.
if the tooth is worn out, you give a protective layer. You fill up that part of the tooth which is worn out. If it's a cavity, then you have to nicely clean it up and give him a restoration. If the gum has receded, then you have to ensure that at least it doesn't go down further. It stops where it is, because if it continues to recede, then you lose the tooth eventually one day.
Done, done. So next question is VV Harish. Doctor, my son's jaw is getting dislocated frequently and he needs to adjust it with hands. Why is this happening?
So this is something called the temporomandibular joint. The joint on which the only part of the entire face bone which can move is your lower jaw. So that is connected to a joint called the temporomandibular joint, and that joint is getting affected because of either stress or trauma or some kind of a disease. So he needs to meet up with a maxillofacial surgeon, identify the reason why his joint is behaving like that suddenly, and start acting on it, because you can't possibly ignore it. A hypermobile joint eventually will cause problems, so it has to be corrected at this stage, most importantly.
So what are the ways of correcting it, doctor?
So if it's just stress, then you could give it medicines. You could start off with medicines and reduce the pain and the the discomfort that's happening. Once, if that is not there and if there's active disease in the joint, then maybe you could go in for surgical treatments, which could be lavage and maybe correcting the articular disc. And the third thing would be to find out if there is any adverse bite. Sometimes patients aren't biting properly, and that could be also because of a particular reason. When you don't bite, so you cause stresses on the joint. So you have to correct the occlusion so that the joint stresses are reduced and the mobility is brought back to normal.
Okay. Done. Thank you so much. So, a lot of children and cavities question, milk teeth question, which you have already talked about. But still, is RCT safe for 9-year-old child? And also, that is a question from Saurabh Garg. And Ravi actually continues with his daughter's question. Will simple precautions work for cavities in 5-year-old children? And
Yes,
that's it. Yeah,
definitely.
advice for cavities yeah, cavities in a 5-year-old. A lot of them are asking about milk teeth and cavities.
So milk teeth, as I said, they get decayed faster. So you need to be very careful that one, the brushing is done twice a day and there is no food stuck both the times after meals. Normally we recommend after breakfast and after dinner. So that's the first step that you can take to make sure that the cavities don't form. If they have been formed, then you have to clean them, fill them for sure. And the third part of the question was that in case you is it safe to do a root canal? It is absolutely safe to do a root canal for a child, because if you don't do it, there will be an abscess formed, and that abscess would spoil the tooth coming underneath. There's a permanent tooth coming underneath the milk tooth, and if you don't do this root canal, the abscess would make the next tooth get spoiled, which is not the intention, because this tooth is going to last you maximum 10-12 years, whereas that one, the permanent tooth, has a very big lifespan. We don't want you to get it spoiled before it comes.
Done. Thank you so much. VV Harish is asking this question. The inside skin of my cheeks is coming in between my teeth while eating, and if I bite by mistake, ulcers are forming, and this is being a repetitive problem with me. So it's not about dental,
Yeah.
it's
So
not about gums, but it's about cheek ulcers.
yeah. So this can happen primarily because of the fact that your wisdom teeth are not in position. If your wisdom teeth are normally, what happens is we have all evoluted from a monkey, and the jaw size is progressively reducing, whereas the tooth number is the same. That is, all of us have 32 teeth. So what happens is that the younger generations, the third molar or the wisdom tooth doesn't get adequate space, and it comes a little teda, or it doesn't come at all, or it gets stuck halfway. And when it is not in position, if it is outside towards the outer part of your cheek, you end up biting on the cheek. And the only solution to this is to lose the wisdom teeth. And the fortunate part to this whole fiasco is that even if you were to lose your wisdom teeth, uh, you don't look bad, and you don't eat. Uh, you can eat equally well. So I have my wisdom teeth taken out from one side, and I'm sure nobody can make up that. And I can eat well from both the sides. So I normally tell my patients that when you're younger, take your wisdom teeth out, because it's easier for the surgery to heal. You know that you have to get it done. Don't delay it till you're 60, 70, because that's the time when surgeries are not very easy on the body. So if you have to take the wisdom tooth out, take them out as early as possible, because it'll be easier for you to heal after the procedure.
Done. So here's a general question. How many times do you suggest that we do brushing? Yeah, that's a question from, where is this? Yes, Adish Jain.
Yeah. So what I normally recommend is that you brush once after dinner and once after breakfast.
Right. So that's
In between the
enough.
day, in between Yeah. So in between the day, okay. So I'm coming to the second part of the question. The in between the day, what you can do is that you should rinse yourself very well, and what I said earlier in the show was that you do something called tongue brushing. If there is food getting stuck, which your tongue, which is a very sensitive and a smart organ, tells you that food is getting stuck in between your teeth, and that area will have to be cleaned better. So, interdental cleansing, which could be in the form of a floss, which could be in the form of dental floss and maybe an interdental brush, or forceful rinsing. All three mechanisms can help clean it in between the teeth, in addition to your brushing, which you've done twice a day after meals.
Great. So let me now move on to the questions which are relating to gum disease. I'll ask you three questions from three different audience, doctor. One is Mr. Guru Mohan Babu, who is a 50-year-old male. I'm having an issue of gum disease. He did not give me any other details here. And the next question is from Mr. Mahesh Ramaya, 41-year-old male. I'm losing gum. How to make gum grow or strong to cover the teeth? And Nitin Singhal is asking, what is the procedure to tighten the gums to prevent tooth loosening?
Okay, so I'll give a brief about the gum disease. Gum disease is genetic. If your parents have had it, you are predilected, or the chances of you getting it is much higher. The first and foremost thing that you must do is ask a pointed question to your parents that did they lose teeth because they got loose? When I ask my patients, did your parents have gum disease? They say, no, they still have teeth. Fine, they had 32 teeth. But did they lose any teeth because it got loose? That's a pointed question. If they say yes, there is a very big chance that your parents had gum disease. You don't get loose teeth unless you have gum disease. The tooth will get loose only if you have gum disease. Now, going to the question whether you want to, how do you maintain that? So, such patients who have family history have to be very careful so that the next progeny, their progeny or the next generation also doesn't reach that stage at all. How can you do that? You go to a periodontist or a general dentist. He evaluates your gums. Makes sure that you don't have bleeding gums. He doesn't have loose, you feel that you're not able to chew well, or your teeth is getting, your food is getting stuck in between your teeth, or uh, lastly, if you have foul smell. All these reasons the gum specialist will find out if you have. He will do something called a basic cleanup or a deep clean, or in medical terms called an SRP, which is scaling root planing. When you do a scaling root planing or an SRP, you remove the deposits which are causing the gums to swell and recede and bleed. That's the first level of treatment. And that will ensure that your gum disease stays at bay. It doesn't come back and affect you. That's how
All right.
it should be addressed.
Okay. Next question is I'm going to ask you two questions from two different people. Both of them are asking about crowns. So, first one is Anil Gupta's question. Can a crown be applied without RCT if the cavity is big and filling does not stay? One. And the next question about uh, okay, the same thing. Anil Gupta is asking if there is gap between one teeth with one with crown. Do you suggest the replacement of crown to cover the gap, or using water floss to remove food particles?
So I'll address the first question first. When you said that, can you make a crown without an RCT? Definitely, yes, you can. Uh, Better still, if you, unless you already have a crown, then you have to replace it with a crown. But if you don't have a crown and you have a space and the filling is not staying, you could do something called an onlay. Onlay is half a crown. See, whenever you make a crown, you grind the teeth from all four sides. Whereas an onlay, you cover only the part of the tooth which is missing or you feel is coming out. So you replace it with that part only and you don't grind the whole tooth. So that's the first question. The second thing was whether you can manage with a dental floss, with a water flosser.
Water
Uh,
floss.
a water floss, yeah, water flosser. To a certain extent, yes, the water flosser works, but I feel a better way still would be rinsing. Remember when I said forceful rinsing? That would create more pressure than the dental floss, I feel sometimes. So you can, when you can do a forceful, vigorous mouth rinse, that works like a dental floss. But if you like the dental floss, you're most welcome. Go ahead and use it.
Done. So now
I would
there are two.
suggest,
Please
sorry
come.
I cut you off. You could still use, if that gap is so big, my suggestion would be use an interdental brush that would clean the area as well as remove the food that you want to displace or remove with the water floss. That's the best way of working with it.
Done. Question about Neha Kanoria's question is about the color of the teeth. My teeth are yellow in color. Can I get them into whiter color?
Yes, definitely. Has she given her age?
No, she's not. I can ask them. नेहा जी
Okay.
आप जरा
So,
age type कर दीजिए. But we can
dental
continue.
color, definitely. So the whitening definitely helps to get back to your color. Before the whitening, you can possibly, as I said, every year that scaling and polishing would restore the color back to its natural form or what it is. If the teeth can be discolored because of two reasons: stain within the tooth, stain over the tooth. If it's over the tooth, it would be cleaned with your routine scaling polishing and it'll go back to normal. But if it is colored within the tooth, that is the intrinsic stains, those can be removed by whitening procedures. The only disadvantage to the whitening procedure is that it causes transient sensitivity for a while, but then you definitely have white teeth after that. And the last
Done.
thing that I mentioned is some people have discolored teeth because of the fact that they had fluoride in the water. So it's called fluorosis or it's called mottling, where the tooth structure is not very smooth, it's rough and it's got pits in it. Now that's a problem which can be addressed to a certain extent with whitening. It will not totally go away, but it will definitely make the person look better.
Done. Yet again, a question about discoloration and stains. This is Rashmita Mohapatra. The patient age is 22-year-old. Always facing black stains issued in teeth and bad breath doesn't. Okay, teeth के stains are black stains and bad breath भी है. Doesn't consume tea or coffee or iron tablets or any medication. Water consumes doesn't have iron. What is the reason for the black stain?
Um, See, what happens is there is a particular microbe in our mouth which leaves a black stain, and certain people are unfortunate to have that particular microbe as a commensal organism in the mouth. Means it's a healthy microorganism. It stays in your mouth and prevents a lot of other problems, but it leaves a black stain. So maybe you're the unfortunate few who get that black stain very often, and I'm sorry to say, but the only thing you can do is routine scaling polishing, or just polishing sometimes will remove this. And that polishing will have to be done at the dental center and take care
And
of the
there's no
black stain like you
one-time cure
mentioned.
for this. There's no
There is
one-time,
no
and
one
it's a
time cure.
yeah.
No. It
And
comes
I'm
with
one
many
of them.
years.
So I'm one of them, and while being one of them, I don't have it on the outside, but I have it on the inside. So that is a blessing in disguise. So every 6 to 8 months, I go get a scaling or a polishing done. It helps me to quite a long extent. It's only in the COVID lockdown that I could not get out. I took a break of 2 years, and it appeared really very dark in the insides, as
Yes,
if I had.
unfortunately, you'll be surprised to learn that even I have the same stains. And everybody at home tells me that every 2 3 months you need to get your teeth polished, otherwise people will say that the doctor has black teeth. So I have a
Yes.
similar problem, and I asked my wife or I have a very good hygienist at the hospital, and he does that for me. He gets the
Yeah.
polishing done and the
It's just
stains removed. I
management.
unfortunately.
That's okay. So there is a lot of people with that. I think we're giving assurance to Mohapatra that yes, people do continue living with this and it's not dangerous. It's just you need to
No,
manage
no, no.
the issue.
No. Not
Yeah.
at all. Not at
Done.
all. It's
Thank you
it's a
so
very
much.
mild problem which will go away with polishing.
Great. So this is Arup Kumar Das' question. Arup Kumar is 50-year-old male having healthy teeth, but in front one of the teeth hair crack is appearing for last 3 to 4 years without any issues or pain. Is this normal?
Yeah, so these are called craze lines, and generally craze lines are if they are not giving you a problem, you can kind of let it go. The only reason is that the only thing that you should be careful of is you should not be biting on betel nut, supari, or very hard things, because then these crazed lines can progress, and once they progress, they can be painful, the tooth can fracture as well.
Done. Next question is Vinay Gupta's question. Doctor, there are many different types of toothpaste and brushes available. How to select a correct paste and a brush which will serve the purpose? And also, I always keep telling people that you need to change your brush often. So, especially people at home. What is your professional advice, the expert advice?
As regards a brush, I feel that you should use a very soft or a super soft brush. The idea is to clean teeth, not to wash clothes. Uh, so you,
Fantastic.
so you, so the first thing you do is you buy a super soft brush. It lasts only 3 months. So the way to gauge is if your brush, the bristles are swaying away less than 3 months, or let's say less than 2 months, that means you're using too much force. And if you're using too much force, there's a trick which I normally tell all my patients. When you brush your break, you use your wrist, not your arm. Just break
Okay.
it at the wrist. The forces, when they are broken at the wrist, they get diluted. Whereas if you use the entire arm, then there's too much force being exerted. So first use a very soft brush to break the forces at the wrist, and make sure that you're not. The way to find out if you're doing the right thing is see that the bristles stay straight and they don't get sway away. The life of a brush is generally about 3 to 4 months, not more than that. You need to change after that. And the next thing that they said was a paste, right?
Yes.
Pastes are like so, any toothpaste will work, whichever you like. Generally, gel toothpaste are a little more abrasive. Regular white toothpaste are not. So I would suggest use a regular white toothpaste and not the gel if possible. That's about all.
Yeah, great. So, in continuation to that, one of the question I was addressing about a brand toothpaste, which I cannot mention here. They've been using that red color toothpaste for a very long time, and they had sensitive issues. So they moved on to a sensitive paste, which helped. So, do you think the toothpaste can cause sensitivity issues, and a sensitive toothpaste will help the sensitive issues?
Yes, so as I said earlier, that the abrasive toothpaste or the gel toothpaste can cause abrasion on the tooth structure. That abrasion can lead to sensitivity, and then once the sensitivity or the abrasion has happened, you will have to get them filled or restored back so that the inner layers stay protected. The outer layer of the tooth structure is the hardest, that's the enamel. The inner layers are very soft. Once the abrasion has happened and the enamel has worn off, then you do not have a choice of not restoring the tooth. You will have to restore the tooth back to its normal structure so that the underlayers or the nerve structure is safe and the sensitivity doesn't happen. Now, this gentleman said that I was using a sensitive toothpaste. Fine, use a sensitive toothpaste, but don't use it endlessly and do not restore the tooth. Restore the tooth and get back to a normal toothpaste so that the next time you want to use a sensitive toothpaste, if sensitivity happens again, it works. If you're endlessly using a sensitive toothpaste, then you won't really realize what's happening on the tooth till the time hell bells happen and the nerve starts getting affected.
Done. Here's a question from Jaspal Singh who says, I've got my RCT done, still food is getting stuck at the same place.
So, the RCT entails the treatment around the nerve structure. That means when you say an RCT, you normally fill up the nerve structure or the canal. The canal has the nerve, and you fill up the nerve, and that's it. Now, post RCT, you're supposed to fill up the axis through which you reach the nerve structure. Many times the access to the nerve structure is not filled very well, or is filled with a temporary filling material, or is filled with something called an intermediary filling material, not a permanent material, or is not filled very well such that the food in between the tooth is still getting stuck. Now, in such cases, the tooth will further disintegrate, food will keep accumulating into that hole, and slowly the tooth will either break or wither away. So that has to be restored, and eventually it has to be either covered with a dental onlay or a crown, which is more suitable depending on the amount of tooth structure that is lost.
Yes. So this is Saurabh Garg. Naresh's age is 72. Having BP and sugar, is it safe to do RCT at this age?
Absolutely. BP and sugar, fortunately, do not affect the treatment of the tooth. Whereas if you're doing a surgical treatment, you will have to be very careful that you don't affect your. I mean, that could. You need to be careful that your blood pressure as well as your blood sugars are fine. But fortunately, when it comes to the tooth only, that means you're drilling a hole, doing a root canal, or filling it up. That can be done even if your blood sugar and blood pressure are not in control. Having said that, it doesn't mean that you keep it high.
Okay. Rakesh Ambasana's question is, he's under chemotherapy and have lost teeth. A few teeth loss hai, half of them are broken. Oncologist has advised not to do RCT or remove till chemo is continuing. I have to frequently get the teeth cemented or filled. Any other options, sir?
Yes, that is a stage where one has to be careful. If your oncologist says that you cannot possibly go in for aggressive procedures, you should not, because it's more risky. Ideally, what we normally do at Indraprastha is that before a patient goes in for any kind of chemotherapy or radiation, he's sent for a dental checkup. The dental treatment is completed, and only then the chemotherapy is begun with. So, a dental clearance is a must before you start treating any kind of carcinoma.
Done. Thank you. Here's Kushbu Sheikh who's asking, my teeth get cavity in spite of brushing twice a day and rinsing my mouth with plain water every time when I take a meal. What is the probable reason for this? And yeah, that's it.
My question to this person would be that how often does she get herself checked? See, what happens is I appreciate that you've been brushing very well, so that would prevent further caries from happening. But what is already set in cannot stop. So that has to be first checked by the dentist and then restored. Even if you brush, you can prevent the new teeth from getting affected. But the ones which are already affected, unfortunately, you will still have to get them restored even if you're brushing them twice.
Done. So the next question is also something similar. Ratikanta Panda. Affected by caries, most of the teeth are degenerating. What do I do? I'm 59-year-old, diabetes for the last 7 years.
So he's saying that he has diabetes and he's got teeth which are cavities. All the more
Cavities,
reason.
yes.
See, what happens is that diabetes is like termite in the body. That's how I kind of address it. So I tell my patients that if you have diabetes, you have to be twice as careful as a regular patient. You will be surprised to learn that your blood sugar will not be maintained in case you are having gum disease. If you have gum disease, it will not let your blood sugar come down or be in the right place if you do not manage your oral health or your gum disease. If you manage your gum disease, your sugars will be maintained better. And at the same time, it can be vice versa. Your diabetes can cause problems in the mouth to a big disease, to a big extent. Gum disease can progress and it will not come under control. So both have to be addressed very, very aggressively, and only when you address both at the same level with the same intensity will you realize that both are controlled.
Done. So, continuing the diabetes sequence of questions, Krishnan Subramanian has, what are the methods of stopping gum bleeding for a patient who has diabetes under control?
The way would be every 6 months you go to a periodontist. He does something called scaling root planing. That's the basic treatment. In case your gums do not respond to scaling root planing, then you might need stage 2 of periodontal therapy, which he will explain, the periodontist will explain, and you will have to carry on with that.
Krishna Kittur, 73-year-old male, hypertension, diabetes under control. Every 4-5 months, I get white, painful patches on the gums. I use Dentogel cream and take B complex tablets. 5-6 days, I get relief and it continues. What is the cause?
These white patches, if I'm understanding it right, could be white lesions of the mouth. Now, these white lesions are basically autoimmune disorders like lichen planus or leukoplakia. If they are what I'm thinking, he would need to go to a oral medicine specialist. Their dentistry has 6-7 fields of specialty. Oral medicine specialists can address this problems the best, and it would be better if he educates himself about this disease, because this kind of problem does not go away. You have to live with it, and there'll be active and inactive states. So the best would be that he kind of understands the disease, lives with it, and at the same time treats it as per the advice of the oral medicine specialist with the diseases, with the tablets or ointments that he mentions.
That is a piece of information which I have not come across. Thank you so much for giving that advice, doctor. And next question is Alka Muthukumar. Her child has permanent teeth appearing even before the milk teeth are shedding. What is the reason and what can she do? My child had the same problem while she was growing too. We had to forcibly extract the ones.
Generally, what happens is that permanent teeth come and they push the milk teeth away. Sometimes that doesn't happen. The permanent teeth and the milk teeth are not in the same line, so they come a little under or a little outside. In that situation, I normally advise my pediatric children or patients is that play with your tongue and let that permanent tooth, उसको तो आप कुछ कर नहीं पाओगे, but जो milk tooth है, the milk tooth should be fiddled with or played with the tongue only, not with your hands or fingers. Keep fiddling with it till the time it becomes loose and take it out. Or you can have something like an apple or a corn or something hard, carrot and stuff like that. All these hard things will make the tooth loose and you fiddle with the tongue and it will come out. Now, if that doesn't happen, then we are always there to help you out with it.
Done. Last two questions that I would want to take, because most of them have been covered somewhere or the other. This is jawbone के वजह से teeth हिलता है. So the jawbone is very weak. Is this a issue to be addressed? They say that the jawbone is weak. Kalpana Ranade.
Okay. So teeth are embedded in bone. Normally, 1/3 of the tooth is seen outside and 2/3 is inside. When the bone levels go down, the tooth starts shaking.
Okay.
Once the bone levels have gone down, you can possibly treat them with aggressive periodontal procedures like flap surgery, bone grafts, and splints. But if it has gone to a level where there's only 20% bone left and the tooth is shaking, or what we said, it is doing disco in the mouth, it is better taken out. Because then you're spoiling the tooth next to it on both sides. So to save one tooth, don't spoil the two teeth adjacent to it. Make sure that you uh, lose the tooth, so that when you go to a gum specialist or a periodontist, he grades the mobility of the tooth, which is in the jawbone. He feels that the mobility is treatable, he will treat it. If the mobility is to a stage where it is gone beyond repair and it is spoiling the next two teeth, you have to take them out and salvage the next teeth or adjacent teeth rather than working on thinking about only this tooth. People endlessly keep that teeth, not keep using it. You can't use that tooth if it's grade 3 mobile, but they keep it in the mouth, not realizing that the adjacent teeth are getting affected very badly. So you need to address that.
Yes, doctor. Last question is, how can I cure dental problems in the first trimester of pregnancy? Is it okay to do RCT and take antibiotics? This is Abjin asking.
You can definitely treat yourself in the first trimester. unless your gynecologist specifically says no, because she's the one who's handling your child as well as you. So if she says no, then you can't. But the book says that first and third trimesters are relatively safer to treat pregnant ladies. Antibiotics, some gynecologists allow it, certain drugs are allowed, certain drugs are not. But then again, it's to the comfort level of the gynecologist who's treating. So normally I tell my patients, again, a tip of advice, don't think it becomes very easy after delivery to treat yourself. Immediately after delivery, things are, you have your hands full. So I normally tell my patients, do not delay it. Treat yourself in the first and the third trimester. Certain drugs are allowed, you can have them, and if you're asking me if the treatment can be done, it can be.
All right. So we'll conclude this session here. I would want to give us some top tips, but with leading into this question, Parihar is asking this question. Does smoking lead to dental issues? And I would want you to give us top tips on, yeah. And with that question, I would want you to give me top tips to take care of dental health.
I will. So the first thing was smoking. 25 years ago when I graduated or did my masters, I realized that smoking was not so bad. But then in the last 25 years, uh, the advancements and the research that has been carried out says very clearly that it is very, very destructive. It's a silent killer. It doesn't immediately manifest itself in the mouth, but slowly it will cause a lot of problems. Teeth get loose, your gums darken, and vessels get, the blood vessels get clogged. So the blood supply to the tooth reduces because of the nicotine as well as because of the heat. And that takes a long, long time to reverse. Normally, gum disease is much more in smokers. Dental treatment outcomes like implants are 50% subject to failures. So definitely, I would say that smoking causes a lot more problems than what we are aware of. As regards the tips, I normally tell my patients brush twice, both the times after dinner, after breakfast. Do a lot of oral rinsing when you're not being able to brush. You can't possibly brush the whole day after every meal. So try and rinse very well. Uh, least or the I mean something which is most ignored is interdental cleansing. You can clean your teeth on the outside and the inside, but in between the two teeth is the space which gets the maximum amount of abuse or food accumulates. Interdental cleansing with a floss or a interdental brush is very important. And lastly, most important, use your tongue to tell you where the food is getting stuck. After you had a meal, you don't have access to water, you don't have access to brush, you can use your tongue to tell you if there's food getting accumulated and then specifically work on that area.
Done. Thank you so much, Dr. Adosh Lall. It was a great session. You had very patiently answered all the questions. Thank you for this wonderful time on a Sunday morning. Namaste. Yes, so that was Dr. Adosh answering all your questions. And now I'm going to ask you 3 questions. Health quiz coming up your way. Answer the questions in the YouTube chat box. I'll be announcing the winner's name towards the end of the show. Winners will be selected at the sole discretion of Apollo 24/7 team. And winners, once you are declared a winner, please do share your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. Now the questions for today are, question number 1. When is World Oral Health Day celebrated? आज इसी के बारे में हमने बात भी किया था. So if you know the answer, go ahead, type it in the chat box. When is the World Oral Health Day celebrated? Question number 2. How many teeth does an adult human have? How many teeth does an adult human have? Very simple. इसके बारे में भी डॉक्टर साहब ने एक क्लू दिया था. While mentioning, he did give you an answer there. So question number 3 coming up. Where can you find your reports and prescriptions in the Apollo 24/7 app? If you open Apollo 24/7 app, answer तो आपके सामने दिख जाएगा. Where can you find your reports and prescriptions in the Apollo 24/7 app? And these are the 3 questions for today. Go ahead, type the answers in the chat box, YouTube chat box specifically, and I'm waiting for the winners. In the meanwhile, let me tell you about exciting offers. सैटरडे एंड संडे में, सैटरडे तो खत्म हो गया, अभी संडे बाकी है. हियर्स अ ग्रेट ऑफर दैट आई वांट टू गिव यू. 1 रुपी में आप कंसल्ट कर सकते हो. Instant doctor consultation in one tab at ₹1. Offers valid only on Saturday, Sunday. Saturday तो खत्म हो गया, अभी Sunday है. You can get a consultation for a few specialities only, which are general physician, pediatrician, gynecologist, dietitian, and a dermatologist. If you require any consultation, Apollo 247 में जाइए and right away 1 rupee में एक टैप में instant doctor consultation पाइए. Offer is valid only for today. All right, and also let me give you another coupon where you can use this code first 3 on Apollo 247. Medicines order कीजिए direct Apollo से, get flat 25% off on the first 3 online medicine orders. If you pay via Amazon Pay, you can earn up to 500 rupees cashback, and this offer is valid on orders above 1000 on the first 3 online medicine orders. So use the code first 3. While I'm waiting, yes, the winners are here. Sonu Haldar, Artia Kauser, and Isha 675. Atiya Kauser, I'm sorry. Sonu Haldar 27, Atiya Kauser, and Isha 675. Congratulations, you are the winners for this week. Please write back to us and claim your gift vouchers. And let me take leave from you. Before we leave, here's another coupon that we are sharing with you. Use this code HH247. You get a 199 rupees off on online consultation with Apollo doctors, and up to 20% off on medicine orders if you order from Apollo 247 directly. Thank you so much, all of you, for joining us this week. And next week, we are going to talk about workplace ergonomics and arthritis. Ask an orthopedic expert from Apollo Hospitals. Tune into Apollo 24/7's Health Hour on 27th March, 11 a.m. And if you don't want to miss this, there is a bell icon. Reminder aa jayega. Aap subscribe kijiye, and then you'll not miss any of these wonderful sessions. We shall see you next week, and thank you all of you for joining us and asking your questions. It was a great session from Dr. Adosh Lall, and we thank him as well. Thank you once again for joining us. Namaste. Please take care of yourself.